Hey y'all, I figured I was gonna make this video pretty much because I have yet to see, um, any real information as far as pregnancy and the stuff that I'm dealing with. Um, and it'd be a good resource, I guess, to, reflect back on, know that somebody else is going through what you're going through. So last Christmas, it's been a few days, about 20 days shy of a year, that I ended up with blood clots in my legs and my lungs from birth control. So, with that being said, we just found out we're expecting again. We've got 3 awesome kids. They're amazing. We've lost just as many as we have. So it's a little nerve-wracking. This time things have changed. I have to be on blood thinners now throughout the entire pregnancy. And there's information out there, but there's not a lot of information out there. So, I didn't know what to expect. I thought, it's just birth control. Not a big deal. I thought maybe because it was synthetic that I could get through the pregnancy without having to be on blood thinners. Yeah, that's not the case. They said there's no way of proving that my issue was because it was synthetic hormone versus natural, that I just reacted to estrogen in general. So I have to be on blood thinners. Which is fine. Whatever. Give myself a shot daily. Alright. But with that comes, it's scary. If you go into labor early, if you, miscarry, that's scary stuff. Genuinely terrifying. With that being said, I also have POTS. POTS is postural orthostatic tachycardia syndrome. And in my previous pregnancies, I was undiagnosed, didn't know what we had. I was passing out anywhere from 12 times a day to, I don't know, my first pregnancy I only passed out twice. So, my last one, it was really, really, really bad though. So, I went and got checked out and, it was POTS. So, with that being said, I'm on Midodrine to help regulate my blood pressure to keep my heart pumping at a somewhat normal rate. So, I'm not having as many issues as I did. But there's also this unknown when it comes to pregnancy. I'm about 5.5 weeks along now. Maybe just 5 in a couple days. I don't know. I know my due date's August 14th. So yeah, it's just crazy. The Midodrine is known for shrinking your blood vessels, constricting them so that the blood volume goes back to your heart, essentially. So that can affect the placenta and the placenta growth. And so I'm being monitored for a number of things right now. And, hopefully it all goes well. But, I figured I'd post this so somebody else maybe, they aren't dealing with blood clots, but they have POTS and they're thinking about a pregnancy, or maybe they don't have POTS and they're thinking about a pregnancy, but they've had blood clots. It's an unfortunate situation. I was 24, now 25. So, yeah. I'm still young. I'm still at that point where, I haven't gotten out of that I want to be a mom still phase. I haven't, wanted to move on to the next phase of my life yet. I want to feel like my family's whole. So, this is what we're doing for now. a little unexpected this pregnancy. We're gonna try and meet with the OB-GYN and the MFM to set up care before getting pregnant. Little did I know, 2 days after the OB-GYN appointment, we found out I was expecting. So, a little early, but, you know, it's okay. I'm getting an ultrasound around 6 weeks. Apparently that's what they do when you're on blood thinners, to confirm that there's a heartbeat. So if you miscarry or have an ectopic, etc., like I have, both, that you don't bleed out, that it is a viable pregnancy before they put you on the blood thinners. So, just, I mean, it's going to be bizarre. I passed out because of the POTS, stabbing myself with needles, so we'll see how that goes. I might have to teach my kids how to do it. Because unfortunately, my husband will be in and out over the next year, so. Anyways, that's what I really have to say, I guess. I'll keep posting updates and what my experiences are. Essentially, she just said that I'm going to have a few more ultrasounds to make sure everything's okay. Which I'm totally okay with. What mom isn't? I mean, now I'm just like afraid of the long-term damage and stuff that could happen. Like, no mom's mind really ever wants to go there, but you're a mom, so it goes there. But yeah, this is my first post. Sorry if it's a little drawn on and essentially say a lot, you know. That's what happens, you know. Alrighty. Well, thank y'all for being curious. I'll continue to update y'all as things progress.